Okay, and welcome everybody. Reagan Archibald here with East West Health, and this is your health transformation course. And really excited to talk about this subject today because it's been one of the most exciting breakthroughs of 2018, I would say, that I've had, is really looking at health going beyond just this. And you can fill that out in just a second, Chris. I'll explain it first, but we're going to move beyond this this mindset that your health is wherever your health is, it's stuck. That's a common mindset, is it's your age. And I know last week we talked about aging, how we need to start looking at aging as the largest contributor of death. It is a disease, even though the CDC doesn't recognize it as a disease, but aging in and of itself is a disease. So now I want to talk about something that's going to be really important to help you just transform your entire health, which is called the abundance cycle of health. And the abundance of cycle of health, it all starts with gratitude. So everything in our life, anything that you want to grow or anything you want to nurture needs to start with gratitude. I mean, think about the relationships in your life that mean the most to you. And think about when those relationships don't work. And usually it's when you're coming from a place of scarcity or you're mad at the other person. And so when you have gratitude, you can't have gratitude and negativity in your brain at the same time. So let's start off the day with gratitude. And I'm going to share with you a quote here. I got this cool book called Everyday Gratitude, but it says, showing gratitude is one of the simplest yet most powerful things humans can do for each other. And so here's the challenge for you today. To whom would it be meaningful to send a handwritten letter or card? Now, on Monday, I had this unusual treat. I had 2 thank you notes that were handwritten that showed up on my desk Monday. It was really phenomenal. So it made my day. And so I don't know if you guys can think of somebody right now that you could write just a nice little something about, and watch how it changes your energy. It's phenomenal. Even they've done studies where they found that when we watch someone else perform an act of kindness, it changes our physiology. So our serotonin and our GABA goes up. Our oxytocin, which is that hormone that makes us feel connected, that improves. So all of these things can be increased with gratitude. But in your health and in everything in life, we've got to start with gratitude. That's where the abundance cycle starts. And I've been working with over 50,000 patients that have come through East West. The patients who come with this attitude of abundance, that my body can heal, I have all the resources necessary, I just found a team to work with, that gratitude is going to help flow into the next step, which is creativity. So creativity, I think creativity is one of the keys if you're looking to transform your health. And once again, this is your health transformation course. And so transforming your health does not mean where you're just making small incremental changes. This is a top to bottom approach. And so if you're not creative with it, you're leaving a lot of health and abundance on the table, because some of the ways you can get creative with health is you can get creative with your food. What are you eating? Do you really need to eat the same thing over and over again? So think about being creative with the foods that you're eating. Also think about being creative with your relationships and how you can foster new activities that lead to better health. So instead of going to a movie on Friday night with your significant other or your friends, maybe you should say, hey, before we go to a movie, let's go on a hike. And if you live in Utah, which I know a lot of you do, you say, well, maybe let's hike up to let's hike the Red Rock Butte, and or let's go on the Shoreline Trail. But think about some ways of getting creative with your physical fitness. I also find that creativity comes when I want to get to the next level. So mountain biking season started, and so I've been very creative in putting in workouts before I actually got on my mountain bike to actually get some of these leg muscles a little stronger, doing more lunges, also doing a lot more time on the bike, which I'm not a big fan of the Recoma bikes when I could be outside, but with the weather in Utah right now, it's in end of April, so we have muddy conditions on the trails, and it's it's the best that I could do. But get creative in those aspects. The other area that's really important is if you're struggling with a certain type of chronic disease or any ailments, then you have to start looking at getting creative with getting to the root cause, like not just stopping. Yes, we've ran a lot of tests for you, and Chris, we've run you've had all your testing work done now. Mm-hmm. And so now is where the real creativity comes out, where you take those lab reviews that we've taken you through, and then you just start looking at those and saying, okay, how can I do my own research and ask the practitioners, just get them to dig in with you in this process. But that's where some creativity can come in. But this gratitude will open up your mindset so that you see that the world is full of possibilities and endless opportunities. And that's that's creativity. Steve Jobs, what he said is creativity is simply putting great ideas into action. I mean, I'm paraphrasing, but basically you take you bring in new ideas, but then the creative part is where you manifest it through your life. But what happens is we start with gratitude. Gratitude is the foundation for everything. The next step is we move into creativity, and that creativity is where we get the inspiration to move into cooperation. And a lot of us, we try to do it on our own. We try to get healthy on our own. We try to, maybe we think we've got it, and we don't need to have any type of partnerships with anybody. But the cooperation that can come with other people is what really propels you forward. I grew up, as many of you know, I grew up on a farm in Idaho. I was exposed to a lot of chemicals, and for at least 5 years, I was doing it on my own. I was going to health food stores. I was reading books on nutrition. I was really looking for health on my own. And it wasn't until I was in my early 20s where I actually went to this great naturopathic doctor and finally got some help. And with that cooperation, I finally decided, okay, I've got to look outside of the conventional medicine. My uncle was my primary care doctor. All I'd gotten when I was a kid is just prescriptions, antibiotics, steroids. Ended up with really poor skin conditions, psoriasis. I had asthma. I just was not feeling great. I mean, I'm almost 40, and I feel 10 times healthier than I did when I was 20. But it wasn't until I found someone to cooperate with that my health went to the next level. And so I think once we have the gratitude, we start to realize, man, there's people that really care about me, and people who want to see me get help. And then we get creative and think, okay, who are those people, and how can I find those people who can really inspire and motivate me to do a little better? And then once you find those people, then the cooperation comes in, because health is always a two-way street. And one of the exercises we're going to do today is called health independence. And so what this health independence worksheet is going to do for us is help us discover what health independence means to you. And I find that health independence does not come without some type of cooperation with other people. One of my mentors, he said, the doctor who has himself for a patient has a fool for a doctor. So I'm always looking for outside resources to help me analyze my labs, help me understand what's going on with my health, crafting a fitness program, and it's been very exciting. So once you start to cooperate with others, then what happens is this door of opportunity opens up. And this is, I think, one of the greatest things about living in America. I saw Alexander Hamilton. Have you followed that at all, Chris?
I have a ticket to go for the first time. I'm really anxious to see it.
I didn't even know it was in town, and my mom surprised me. My birthday's coming up, and so
awesome.
So yesterday after work, my wife's like, "Hey, we're going down to we got dressed nice, we got this thing going on." I'm like, "What?" And then I show up at my mom's at the restaurant, and my brother and his wife, and we went to Alexander Hamilton. It's really phenomenal.
Oh, great! Can't wait.
Yeah, they do a great job. When are you going?
May 6th. So I think
May
that's
6th.
the last night, actually.
Yeah. Okay. Yeah. Then I think they go to Vegas after that. But yeah, if you look at the, Alexander Hamilton, many of you know him. He's on the $10 bill, but he put in the structure and the network so that we have opportunity in America, right? So you take someone in Mexico, and you can literally just bring someone over the border in Texas, Arizona, some of these towns, and just from being in America versus being in Mexico, what the research shows is they'll earn 8 times more the income. That's because we have a system and we have a process here in America where there's lots of opportunities, and you can take advantage of those opportunities. So it's the same thing in your health. Is a lot of times we narrow what we think are our opportunities because we've been misdiagnosed, or we've been invalidated by our medical providers, or we haven't made the progress that we thought. So the opportunities are always there, but the problem is our mindset gets closed off to those opportunities because we're not willing to cooperate. If you're not willing to cooperate, you're not going to be creative, and you certainly will not have gratitude. You close those gates. So the next thing that happens once you start looking at all the opportunities, and this is where I interviewed Naveen Jain, who's he's this entrepreneur. He's got Moonshot Express, so he actually has a business that can harvest energy, hydrogen energy from the moon. He's got a government contract from it. He also is the founder of a company called Biome. And so we do a lot of our new stool testing is coming from this technology called Biome, Biome. And it's been breakthrough technology. But if I did not cooperate with Naveen, I happened to be at a conference that he was at. He spoke at the conference, and he ended up sitting next to me at lunch, which was awesome. And so I got a chance. I had this opportunity that opened up. And from that opportunity, he was on my podcast. And now we're starting to see that this new technology of Biome is giving us much more in-depth understanding of how your gut's behavior is and how the foods you eat affect your biome. So we're able to give people a little more strategic nutritional advice. But I saw that opportunity, but what it created with Naveen was Ingenuity. And so now his whole Biome platform, it's a newer company, and it's been built more for the consumer because the FDA has certain requirements that if it's a diagnostic company, they have to be very cautious. But the way that Naveen saw the best way to roll this out was to make it available for consumers and not have it be a medical test. But if you look at the science and the technology that they're using, it's far more advanced. It's at least 5 years ahead of any other labs that we're using. So the Ingenuity comes in where I've been able to, and our team here at East West has been able to look at those labs and understand what some of these findings mean from a diagnostic perspective. And we've really helped our patients a lot, especially I found out this, taking the Biome, that's where I found out my acromantia was super low. And so then I've started doing more fasting and built my acromantia back up, felt a lot stronger, able to burn some fat that was unnecessary. But once the Ingenuity kicks in, like with like Biome is a company, I just use that as an idea. But the other Ingenuity happens when you start to see, wow, I got my cortisol balanced. I tested my stress hormones. Now I understand what my thyroid's doing. I understand what's going on in my gut. I understand that I need these certain foods. I need to avoid these other foods. My genetics gives me a picture on this is how my detoxification pathways work. But once you start to get that Ingenuity and you start to put it in action and you actually get a game plan, then what happens is you go into exponential healing. And so exponential is when you go from multiplication where maybe it's like, 1 + 1 is 2, and you're just kind of slugging out your health, just trying to get a little bit healthier. This is when you jump into the exponential where it's multiplication, where you go, it's not 1 + 1, but it's a multiplying effect where you have 1 × 3, and then you have 3 × 3, and then you have, whatever this is, but the exponential is essentially where you start multiplying your efforts. And I like to use this analogy I heard from Peter Diamandis, but he said, If you take 30 linear steps, I'd end up across this room. I'd end up in the back of the room there. If I took 30 exponential steps, I would circle around the entire globe, because what exponential means is that's where, 1 becomes 2, 2 becomes 4, 4 becomes 8, 8 becomes 16, 16 becomes 32, 32 becomes 64, 64, 128, and so on and so forth. So yeah, that's exponential. And then the great thing about this is once you're in this cycle where you start to look back and say, man, I have made so much progress in my health. Like, I look back over the course of my life, and I can't tell you how grateful I am that I feel the way I do at this age. At this stage of my life, if I went back and I had to live the last 20 years the way I felt for those 4 or 5 years where my health was just in the gutter, I couldn't imagine that. And so I'm always constantly grateful for that cycle. And then guess what happens? Now I'm back at the beginning. So I have this gratitude, and I can nurture and find more creative ways to stay healthier. I'm always experimenting on myself. If you guys ever want to keep up on my experiments, then make sure you follow us on Instagram, because I'm always posting some of the weird stuff I did, like my brain regeneration treatment, which was phenomenal, or my intermittent fasting, or whatever I'm trying at the time. But it's a process that feeds itself. And so if you get to the place where you start to look back and you start to see how those little tiny improvements in your health make these exponential changes, and maybe that's a change where you have healthier relationships, or you have more energy, you sleep better. I mean, all those things, it compounds exponentially, because then you have a conversation with the person. You're able to be more alert in that conversation. You're able to go experience nature in new ways. You're able to experience spirituality in new ways. You're able just to see what exists out there for you. So this is where this whole thing comes into place. So there's this thing that our brain does. Our brain, we have this big thing called the amygdala that I'm going to talk about just briefly, and then we're going to do this little worksheet. But the amygdala is the barrier, and our brains are hardwired to think in negative terms. If you think about, you go back to some of our ancestors, like, it was a matter of survival. I mean, if you're hanging out with some very big creatures that could literally eat you, you don't have tools yet, our brains are hardwired to focus on the negative. And that's why, you watch the news, and if they don't have some negative stories going on, nobody's watching the news. They've tried it, and it doesn't work. People are attracted to it. You watch when there's a big crisis, and my mom is always the one that's like, did you hear on the news? I'm like, no, I don't watch that stuff, because I know I get it from you or somebody else. But there's a lot of negativity, and that's what we're drawn towards. I mean, unfortunately, you even watch the presidential elections. I did not even listen to them. I just watched the body language of all the candidates, and Trump was going to win just based on his body language, and because people paid attention to him, and most of it was negative. So, and it's still going on that way, but that's just how we are. So I want to help you understand the way your brain works, because your brain will try and pull you back to the scarcity cycle. So if you can stand this abundance cycle, remember, it all starts with gratitude. Right when you start to feel your mindset shift to that negative state, that scarcity mentality, then you got to go start with gratitude. Cool? So scarcity will happen when we start to have this envy, where we start to say, oh, other people have what I want. I don't have what they have. Then what happens when we have this envy is guilt sets in. And sometimes our guilt may be, well, man, I have so much more than they have, therefore I feel guilty. I should do something about it. And we see this a lot in our society. Then the indignation shows up, and that's where we just start getting really angry, and we start to get frustrated with the way things are. And we think, man, how could somebody do this to me? And we become victims. And we think, man, this is somebody else's fault, and somebody's done this to me, and we give our power away in that moment. You no longer have the power to choose health, independence, because now you're in this frustrated, angry state. And then you see all the unfairness, and then you see the depletion. You say, look, my health has been on a downward spiral for the last 10 years, and my relationships, they don't work. Nothing's working in my life. There's no opportunities for me. I'm completely depleted of anything that could ever get me out of this hole that I've dug. And then it becomes a zero-sum game. And then it's like, well, and even if I get healthy, then that means I have to sacrifice something else in order to get healthy. And we start thinking, well, man, if I spend money on my health, then I'm compromising other opportunities. Or if I get healthy, then that means I have to make all these changes and make other people in my life uncomfortable. So that's the zero-sum game that we have. And then that cycle just repeats itself over and over again. So the biggest thing is to stay in gratitude. So hopefully you guys got that. You can see it well on that screen. So now we're going to jump in and just do a couple different exercises. Now, many of you may have this handout, but if you don't, I'm going to write it on this board. So this would be kind of a fun little worksheet. These are our health coaching tools. If anyone needs a copy of these, we're happy to email it. Just put it in the chat room there, and we can email it to you. I apologize, I'm on my own today, and so I am kind of a one-man show. So if you've had questions that I didn't answer, I'm sorry, but it's not too technical, so I figured it'd be pretty safe. Okay, so first thing we're going to do is we're going to do just this little exercise called health independence. Now, I think it's really important if you think about health independence. Chris, what would you say health independence is?
Oh, just being able to travel, enjoy yourself, have a decent quality of life, being able to get out and enjoy playing with your grandchildren, for example.
Yeah, just like, I mean.
Exercise, hike, enjoy
totally.
the mountains.
Okay, so I mean, those are all beautiful. Allows me to. So if you can take your health independence sheet, this one here, and so if you can just write down those things, just take 10 seconds and write down health independence is the main thing we're looking for. So those of you who are not in here, just write on a piece of paper, health independence. That's the topic, and then you're going to put allows me to, and this is the what. What do you want to do with your health independence? Because it's really, it's one thing to be, I want to be healthier, I want to be fit, but why? I mean, what are you going to do once you're healthier? Because you got to create a bigger future for yourself. The next thing we're going to say is, okay, for me to have my health independence, what do I have to know how to do? So this is the how-to part. How to what? So health independence allows you to do what? This is the doing. This is the howing. And so I think what I look at is knowing how to, I think for health independence, you have to know how to cook. You're going to have to know how to exercise. You're going to have to know how to meditate and calm your brain down so that you're not focused on the scarcity mentality of health. The other thing that you're going to have to know how to do is how to cultivate and foster some great relationships and find some deeper meaning and deeper purpose in life. But if you can just take a minute and write down what do you need to know how to do to have your health independence. Okay, so the next one is experiencing life with, and kind of like you said, Chris, it's like, well, I want to experience life with my grandkids, right? They're probably, if you hung out with your grandkids versus friends your age, who's going to have more energy?
The grandchild.
Grandchild, right? So you got to have, it's like, I want the energy of my grandchildren, for example, or I want to be able to really experience life with vitality, with gratitude, with creativity, whatever you want to experience your life with. Okay, now this one in health independence is probably the most important, but this is your next step, which is creates a future for what? And I think of a future where there's excitement, there's energy, there's new breakthroughs, there's new relationships. There's just a future of abundance. And so on health independence, you want to think of, what does a future look like without your health? You know, I think all of us can relate to being in a nursing home or having the inability to transport ourselves anywhere. You know, I always, you know, Chris, you brought up travel. I always think it's pretty sad when I see people, you know, traveling who are unhealthy, and they're, you know, they have to be escorted to the top in a wheelchair. And some of these people are my age, and you can just see how they've let their health unravel. And so I think when you start to think, what does my health independence create a future for? And it creates a future where I can continue to serve and give. Whereas if I don't have my health independence, then everything's lost. So I tell a lot of people, say, man, getting healthy is expensive. I say, well, actually the cost of not being healthy is far more expensive, because what happens if you don't have your health is you're dependent on everybody else to take care of you. And that is the most costly thing you could ever do in your entire life. So we have to think about the future that we can create with our health independence. All right, so that is my health independence functional medicine coaching card there. All right, so now we're going to move on and just take a couple of minutes, and this one's fairly simple but very profound. This one's called reality, and it's your health transformation habits. And so if you look at the habits, what would you guys say, you know, if we're going to have health independence, you got to have good, healthy habits, right? If my habits were, you know, well, I want to stop and get a donut today, get some coffee, and you know, and that became my habit, then I wouldn't get anywhere when it comes to health independence. So it all starts with creating the right habits. And so the first thing I want you to do is write down, what are your healthy habits? So one of the habits that I like is I drink some kombucha in the morning as a way of getting my digestive system prepped to eat. Because I typically have about a 14 to 16 hour window where I'm fasting every day. And so so that would be a healthy habit for me. You know, what are yours? My other healthy habit is I exercise every day no matter what. I do something. Even though last night I was out late, I didn't work out as hard this morning because I didn't get the sleep that I'd like, so I didn't want to put extra stress on my body, but I still had a good workout. So those are healthy habits. I listen to my body, how it's feeling. What are your unhealthy habits? And sometimes just shining light on your unhealthy habits, there's no judgment there. All it is allowing you to see what you're doing and confront the fact that you've got some unhealthy habits. And once you can confront those unhealthy habits, then you can start to shine a light on those and realize it when you start falling into that trap. Because if you think about, you know, we're all, as one of my mentors, Dan Sullivan, said, we're all 100% disciplined to our existing set of habits. And so you think about an alcoholic, they are incredibly disciplined. I mean, they'll be at the liquor store at 10 in the morning, right when it opens or whenever it opens. But they're there, you know, ready to go. So we have to look at that and we say, okay, what are our healthy habits? What are unhealthy? It's not about discipline. This is about you actually finding out what you're doing and what your behaviors are and where they're leading you. Is it towards health independence or health dependence? And then finally, you know, what are your 90-day goals? And this is something that for those of you who, you know, are in some of our wellness programs, you want to sit down with your health coach often and just really craft out a plan. For those of you who are in the Salt Lake Clinic, that would be Jenny. For those of you in Park City, that's going to be Aaron. For those of you who are in St. George, that's going to be Christy. For those of you in Pleasant Grove, that's going to be Brent. And where you sit down and you just talk about your goals. And so then at the bottom I have, who are you accountable to? And the date of accountability. So nice little worksheet for you guys to go through. I can't wait to be talking about this. I mean, this is something that will continually motivate and fascinate me. Health independence, the abundance of health, and how we can fall into these traps of scarcity. But I hope to be talking to you guys about this in 100 years. And who knows if we, that may not be that crazy to think about. So hope you guys have an awesome day, and I'll see you next week for your health transformation. Little dose of love. Take care.
That was excellent.